Putra Malaysia diiringi oleh Dekan Fakulti Perubatan dan Sains Kesihatan Universiti Putra. Lagu Kebangsaan Negaraku dan lagu rasmi UPM Putra Gemilang. Mencari timba si anak dara di bawah sarang burung tempua. Salam sembah pembuka bicara, selamat datang untuk semua. Assalamualaikum warahmatullahi wabarakatuh dan salam sejahtera. Yang berbahagia Profesor Dr. Ismi Arif Ismail, Timbalan Naib Chancellor Akademik dan Antarabangsa yang menjalankan fungsi sebagai Naib Chancellor Universiti Putra Malaysia. Yang berbahagia Profesor Dr. Nurmala Ibrahim, Dekan Fakulti Perubatan dan Sains Kesihatan Universiti Putra Malaysia. Yang berbahagia Profesor Dr. Kulanthayan K.C. Mani, Profesor di Jabatan Kesihatan Komuniti, Fakulti Perubatan dan Sains Kesihatan yang akan menyampaikan syarahan inaugural pada pagi ini. Pegawai-pegawai akademik UPM, ahli-ahli pengurusan fakulti, pegawai-pegawai kanan universiti, datuk-datuk, datin-datin, para hadirin dan sidang penonton yang dihormati sekalian, selamat datang ke majlis syarahan inaugural Profesor Dr. Kulanthayan K.C. Mani. Lebat kemiri pohonnya rendah, dahan terikat tali perkasa. 10 jari kami menadah, mohon berkat yang Maha Esa. Bagi memohon berkat majlis pada hari ini, marilah kita bersama-sama menadah tangan bagi mengaminkan bacaan doa yang akan dipimpin oleh Dr. Ahmad Ikmir Nashrik bin Muhammad Nazan dari Jabatan Kesihatan Komuniti, Fakulti Perubatan dan Sains Kesihatan Universiti Putra Malaysia. Majlis dengan segala hormatnya mempersilakan.
Al-Fatihah. A'udzu billahi minasyaitonir rajim. Bismillahirrahmanirrahim. Alhamdulillahi rabbil alamin, wassalatu wassalamu ala asyrafil anbiya'i wal mursalin wa ala alihi wa ashabihi ajma'in. Segala puji bagi Allah yang mentadbir sekalian alam. Selawat dan salam ke atas semulia-mulia para nabi dan rasul dan penghulu kami, junjungan besar Nabi Muhammad sallallahu alaihi wasallam, serta ahli keluarga dan sahabat-sahabat baginda sekalian. Kami panjatkan rasa syukur kepadamu ya Allah, Tuhan pencipta alam, yang maha pemurah lagi maha penyayang, atas segala nikmat yang Engkau kurniakan kepada kami. Dapat kami berkumpul di sini untuk menjayakan majlis syarahan inaugural yang akan disampaikan oleh yang berbahagia Profesor Dr. Kulanthayan K.C. Mani. Dengan berkat kebesaran-Mu, ya Allah, kurniakanlah kekuatan kepada kami. Semoga dapat kami teruskan kecemerlangan dan kejayaan, serta dapat kami cernakan amalan kualiti dalam segenap bidang kehidupan kami. Ya Allah, berilah kami kekuatan agar kecemerlangan itu dapat dipergunakan seluruh tenaga dan pemikiran bagi menjana nafas baru dalam perkongsian ilmu, kemahiran dan sikap yang mampu menangani keperluan dan tuntutan semasa, selari dengan era bestari dan globalisasi. Ya Allah, Engkau mantapkanlah semangat dan hasil kerja kami untuk terus menghambat kejayaan demi kejayaan dengan penuh dedikasi dan cekal ke arah menjana kecemerlangan yang berterusan. Sucikanlah hati nurani kami agar sentiasa jujur dan ikhlas dalam melaksanakan segala tugas. Mudah-mudahan segala nilai kecemerlangan yang dimaksudkan untuk anugerah ini benar-benar cemerlang menurut penilaian kami, dan cemerlang jiwa di sisi-Mu, ya Allah. Anugerahkanlah kami kekuatan ilmu, iman dan kebijaksanaan untuk menerokai kejayaan. Berikanlah kami kesihatan agar bergerak aktif menabur khidmat bakti kepada masyarakat dan negara Malaysia tercinta, agar kedaulatan tanah air teguh terpelihara. Rabbana atina fid dunya hasanah wa fil akhirati hasanah wa qina azaban nar. Wa sallallahu ala sayyidina Muhammad wa ala alihi wa sahbihi ajma'in walhamdulillahi rabbil alamin.
Majlis merakamkan ucapan terima kasih atas bacaan doa itu tadi. Kalau tuan pikat kenari, jangan patahkan batang jerami. Kepada tuan, sembah diberi, mohon rasmikan majlis kami. Majlis dengan segala hormatnya mempersilakan Yang Berbahagia Profesor Dr. Ismi Arif Ismail, Timbalan Naib Chancellor Akademik dan Antarabangsa, yang menjalankan fungsi sebagai Naib Chancellor UPM untuk memperkenalkan Yang Berbahagia Profesor Kulanthayan K.C. Mani dan seterusnya menjemput Yang Berbahagia Profesor Dr. Kulanthayan untuk menyampaikan syarahan inaugural beliau. Majlis dengan segala hormatnya mempersilakan.
Bismillahirrahmanirrahim. Segala puji bagi Allah SWT, pentadbir seluruh alam. Selawat dan salam kepada junjungan besar Nabi Muhammad SAW, penghulu sekalian Rasul dan pembawa rahmat sekalian alam dan syafaat buat seluruh umat. Terima kasih saudara pengacara majlis, Yang Berbahagia Profesor Dr. Nur Malak Ibrahim, Dekan Fakulti Perubatan dan Sains Kesihatan, Universiti Putra Malaysia, Yang Berbahagia Kenal Bersekutu Pertahanan Awam, Profesor Dr. Kulanthayan K.C. Mani, sahabat saya yang akan menyampaikan syarahan inaugural pada pagi ini, ahli pengurusan universiti, ahli jemaah dekan, ahli jemaah pengarah perikanan universiti, ketua-ketua jabatan, ahli keluarga, tetamu khas dari kedutaan di Hungarian, Robert Dion, Charge the Affairs, Embassy of Sweden in Malaysia. Saya difahamkan kita juga bersama-sama dengan mantan Naib Chancellor Profesor Datin Paduka Setia, Dr. Aini Idris. Tak nampak tadi kat mana tadi. Okey, okey tu. Tiket mahal atas sikit. Okey. Thank you for coming. Kan Prof Dr. Zamri. Okey. Dan Prof Dr. Rampal, thank you. Okay, for being with us today. Seterusnya para tetamu jemputan dan hadirin yang dihormati sekalian. Saya difaham Prof Dr. Kulanthayan ini menarik sebab ramai rakan-rakan daripada kementerian dan juga agensi-agensi awam dan swasta dalam dan luar negara dapat bersama-sama pada pagi ini. Tahniah dan terima kasih saya ucapkan kepada. Salam sejahtera, salam Malaysia Madani, salam segulai sejalai. Alhamdulillah, setinggi-tinggi kesyukuran kita panjatkan ke hadrat ilahi atas limpah dan rahmatnya pada pagi Jumaat yang barakah ini, bagi meneruskan usaha kita memartabatkan kesarjanaan ilmu. Sebelum tu saya terlupa nak sebut, kita juga mengalu-alukan, saya tak pasti dah sampai belum, bakal Naib Chancellor kita Ahmad Farhan Muhammad Sadullah dah sampai ke? Prof Kulen? Tak sure Tak apa, insya-Allah nanti kita alu-alukan kedatangan yang bagi Prof Datuk. Saya amat berbesar hati untuk memperkenalkan sahabat saya yang berbahagia kenal bersekutu pertahanan awam, syarahan inaugural beliau. Tahniah kita ucapkan atas kejayaan dan pencapaian beliau selama memikul tanggungjawab dan amanah sebagai pendidik dan penyelidik yang cemerlang. Tahniah juga saya ucapkan keluarga dan para sahabat dan guru beliau kerana saya sangat yakin kejayaan beliau ini didorong oleh doa, motivasi dan inspirasi daripada insan-insan yang istimewa ini. Yang berbahagia kenal bersekutu pertahanan awam Profesor Dr. Kulanthayan. Beliau mendapat pendidikan awal di Sekolah Rendah Kebangsaan Sultan Ismail I, Kota Baru dari 1978 hingga 1983. Kemudian beliau melanjutkan pelajaran ke Sekolah Menengah Kebangsaan Sultan Ismail dari tahun 1984 ke Maktab. Beliau menerima ijazah Sarjana Muda Sains Ekonomi Sumber daripada Universiti Pertanian Malaysia pada tahun 1995. Kemudian pada tahun 1997 beliau menerima ijazah Sarjana Sains Perancangan Pengangkutan dari Universiti Teknologi Malaysia 2. Okey, salah ni. Bukan 22 ni Prof Kulen. 2002. Okey, 2002. Beliau menerima ijazah Doktor Falsafah Kejuruteraan Pengangkutan. Ini disusuli dengan Diploma Keselamatan Trafik dari Lund University, Lund, Sweden pada tahun 2007 melalui beasiswa yang diterima dari Swedish International Development Cooperation Agency, Sweden. Prof pada 1997 sebagai demonstrator di bawah Jabatan Kejuruteraan Awam Fakulti Kejuruteraan UPM dan menyertai sebagai postdoctoral fellow di bawah Pusat Penyelidikan Keselamatan Jalan Raya pada Jabatan Kejuruteraan Awam Fakulti Kejuruteraan UPM. Pada 2004 beliau berpindah ke Fakulti Perubatan dan Sains Kesihatan UPM dan ditawarkan jawatan sebagai pensyarah dan dinaikkan ke madya pada 2014 dan profesor pada tahun 2019. Selain tugasan di UPM, beliau juga turut menyumbang kepakaran kepada organisasi luar apabila beliau terpilih sebagai ahli lembaga pengarah Global Switzerland pada tahun 2019 bagi tempoh 4 tahun. Kemuncak kepada pemilihan ini ialah apabila beliau diberi mandat untuk menerajui organisasi ini sebagai pengerusi lembaga pengarah Global Alliance 2 tahun yang merupakan warga Malaysia dan Asia yang pertama yang diberi kepercayaan ini. Tanah kepada Profesor Kulen, kebanggaan kepada UPM dan negara. Alhamdulillah. Profesor Dr. Kulanthayan mendapat pelbagai, beliau merangkul 3 anugerah antarabangsa dalam setahun, iaitu FedEx Road Safety International Award di Geneva, Switzerland, anugerah Excellence in Communication Award dari Safe Kids Worldwide di Washington DC, USA, dan jalan raya iaitu The Prince Michael International Road Safety Award dari Prince Michael of Kent sendiri di London, United Kingdom. Tahniah sekali lagi Prof. Okay. Menentasi bidang keselamatan jalan raya. Assalamualaikum Prof. Datuk. Thank you very much. Sila Datuk. So perkenalkan insyaAllah Naib Chancellor UPM yang ke-10, Profesor Datuk Dr. Ahmad Farhan Muhammad Sadullah. Thank you Datuk. Seterusnya pada 2018 adalah apabila beliau memenangi anugerah International Safety Media Awards ISMA di Bangkok bagi kepakaran dalam bidang keselamatan kebakaran. Di peringkat kebangsaan pula pada tahun 2020 anugerah Sustainable Development Goal yang ketiga, Good Health and Well-being, dan beliau dinobatkan sebagai ikon keselamatan jalan raya oleh Yang Berhormat Menteri Pengangkutan Malaysia semasa majlis sambutan ulang tahun Jabatan Pengangkutan Jalan Malaysia. That's why I think juga pihak Pertubuhan Kesihatan Sedunia WHO, Country Office for Malaysia, Singapore dan Brunei Darussalam telah melantik yang bagi Prof Kulen sebagai perunding dalam bidang violence and injury prevention, including road safety bagi agensi antarabangsa kepada UPM. Aktiviti jaringan industri dan masyarakat beliau sangat banyak. Beliau merupakan pegawai bersekutu Angkatan Pertahanan Awam Malaysia dengan pangkat Kolonel Bersekutu, ahli tetap Majlis Keselamatan Jalan Raya Negeri Selangor MKJR, Exco Persatuan Orang Kota Baru POKB, Exco Persatuan Pegawai Akademik UPM, PIBG Sekolah Persatuan Penduduk, ahli Persatuan Satya Sai Baba Kajang. Kekuatan yang ada pada Prof Kulen. Jadi sekali lagi saya sangat-sangat bersyukur diberikan peluang untuk memperkenalkan sahabat saya. Saya kenal Prof Kulen ni daripada kami sama Syarahan first, dan alhamdulillah saya dapat melihat kejayaan beliau, dan insya-Allah tanpa melengahkan masa, saya dengan rendah diri dengan penuh iltizam menjemput Kolonel Bersekutu Pertahanan Awam, Children Safety on the Road, Public Health Vaccines. Dengan segala hormatnya, dipersilakan.
Terima kasih kepada Prof Ismi, yang saya hormati, Prof Normala Ibrahim, Dekan Fakulti Perubatan dan Sains Kesihatan UPM, div-div jemputan yang hadir pada pagi ini daripada pelbagai agensi dalam negara dan juga luar negara. So topik yang saya akan public health vaccines. Sebelum saya mulakan, supaya saya tidak lupa, lebih elok saya mulakan dengan the acknowledgement part dulu. Yang saya ingin menghargai ialah dari segi satu, saya ke mana saya berada sekarang. Yang pertama, Profesor Dr. Rahim mak saya, tapi beliau tidak dapat bersama kita pada pagi ini. Beliau pada masa tersebut adalah sebagai TNC HEPA di UPM, banyak membantu dari segi aktiviti, membantu saya Mertelinggam sebagai penasihat Persatuan Hindu UPM bila saya diamanahkan sebagai Presiden Persatuan Hindu UPM pada masa tersebut. Pemindahan daripada bidang ekonomi kepada bidang transport, mendiang Profesor Madya Dr. Muhammad Nur Awang daripada UTM. Beliau lah yang telah menukar dari segi career saya daripada ekonomi bergerak kepada transport. We lost him during the COVID recently. Dan kemudian apabila saya menghabiskan peringkat sarjana dan bila saya kembali semula ke UPM, saya berjumpa dengan mendiang Datuk Radin Omar Radin Suhadi. It's a privilege untuk saya join beliau. So when I joined him was 1996. I think I just skipped that part. So inilah pihak-pihak yang saya ingin acknowledge. Dan saya terus pergi pada untuk majlis inaugural ini. Of guests who are here, and Her Excellency Dr. Petra Ponavex, the Hungary Ambassador to Malaysia. May I know where are you seated? Thank you, Your Excellency, for joining us today. It's a privilege to have people from Embassy to join our inaugural session. Thank you very much. And also we have from the Sweden Embassy in Malaysia, Mr. Rob, right? And then from the Road Safety Department, from Road Transport Department, and from Miros, we have Prof. Dr. Wong, Tuan Eddie, thank you very much for joining juga. Daripada pihak APM juga, terima kasih kerana bersama kita pada pagi ini. Dan banyak pihak yang membantu kita, terutamanya daripada Majlis Keselamatan Jalan Raya Negeri Pekeso, Pejabat Pendidikan Daerah Hulu Langat, dan some of our sponsors, Gardenia Bakeries, Yakut, friends from the media, dan tidak lupa kita amat bertuah juga sebab kita dapat Prof. Datuk Farhan bersama kita pada pagi ini. Terima kasih Datuk. Okay. Dan tidak lupa semua ahli-ahli jabatan, ahli-ahli daripada Fakulti Perubatan dan Sains Kesihatan, dan juga ahli keluarga saya yang bersama kita pada pagi ini. Terima kasih kerana tanpa anda kita tidaklah ada kejayaan dari segi majlis inaugural pada pagi ini. Terima kasih kepada semua. So let me go directly to untuk menyampaikan in terms of the health burden. If we look at the topic, this is the burden that we have. The number of road crashes in the country, if we see what's recorded last year, is more than 500,000. Keep in mind, not all crashes we record. There are also cases which goes unreported. But just imagine, even the reported cases, it's at this huge. It goes by every minute one reported road crash. And then in terms of fatality, it led us to about 6,000 deaths last year. A huge number for a population of just 32 million people. And if you look from where the 6,000 people deaths come from, the highest number is for the motorcyclists. They take up close to 70%, it's about 68%. And the second group is car drivers and passengers. What I would like to get your attention here is, if you combine the first three groups, motorcyclists, car drivers, and pedestrians, you will take up 90% of total death. Whereas the balance 10% is being shared by all the other type of road users. That's message one. Message two, if you see, the group which contributes least in terms of road deaths are bus drivers and passengers. Public transport is one of the most safest mode of transport comparatively, and the most riskiest mode of transport is motorcycle. So that's the main message we want to cross from here. And why Malaysia, or why do we have these high numbers in terms of crashes and in terms of fatalities? One is, if we look at vehicle population, can you guess what is the total vehicle registration in the country? We are almost there, equivalent. We also have total accumulated registered vehicles, 32 million. So it's equivalent to roughly one person, one vehicle. You can how many households you have and how many number of vehicles you have. So that's the challenge we have here. It's too high in terms of private vehicle consumption. So if we want to address this issue, we need to start moving towards public transport. That's one challenge that we are facing, which has a mixed traffic. Those countries will have huge challenge. When you have mixed traffic, what I mean here by mixed traffic is, on the road system, you have different size of vehicle with different speed level. So then the possibility of a crash happening is always high. Okay? In Malaysia, if you look, we have multiple different types of vehicle in various size. So that's one reason why also it contributes for high number of crash in Malaysia. And the third one is the type of vehicle within that particular distribution. Whichever country, not only Malaysia, you can cross-check. Whichever country which has high number of motorcycles will generally record more number of crash and more number of fatalities. The reason is because motorcycles are 17 times more risky than a car. In a car or in a bus or in a van or in a lorry, you are seated inside the vehicle. Therefore, you have one layer of protection for you. As pedestrian, you are outside of the vehicle. There is no layer of protection. Any crash, the impact is directly to your body. So that's the reason why motorcyclists, the moment you have a crash involving motorcyclists, the probability to lead towards a fatal crash is very much high. Okay. So to give you some understanding in terms of the crashes, the concept of the crashes. The first part is what we call it as a vehicle crash. Say you are traveling and there is a kind of emergency situation, and then your vehicle gets involved in a crash. Part of your vehicle absorbs the crash. Okay, the energy is there. Okay, so the more the frontal part absorbs the crash, then the balance of the energy transfers to the passenger compartment area. The passenger compartment area. So that's the whole idea. That's what will happen in the first part. The second part is the moment the vehicle stops after crashing, it will still be moving, and then finally when it stops, the vehicle are still moving. Okay? So when you are moving but your vehicle has stopped, so what happens? You start hitting the steering, the dashboard, the windshield, whatever the interior of within the vehicle. So that's when the second part of the crash happens. And the third part, what happens is, when you have, your organs are still moving. So when your organs within you are still moving, there is always a possibility for them to hit against each other and crash against each other. So these are the three types of crashes which leads to high number of injuries and fatalities. Understanding, there are many sources outside there, but one good reliable source for the field of medical and health is from the World Health Organization. If you go to WHO website, all these resources are available for you complimentary, free. I'm just posting to you some of those photos, but there are many more, not only for the field of road safety. You can take up, say, the field of violence, for the field of drowning, just list it out. There are a lot of documents over there, and all these are reliable documents. So subsequent, for the subsequent slides that I'm going to share to you are all based on these resources. So today's focus, we are going on children. Why? If you look at out of the 6,000 deaths that we record every year, more per last 2 decades we are recording it, 6,000 deaths. And from that number, roughly 1,000 are children. They don't have any disease, they don't have any sickness, and you just lose them so easily. So these are all preventable deaths. So on that ground, why this topic has been raised for this inaugural lecture is to protect this vulnerable group, to make sure that we don't lose any child from a preventable death. And children has limitation, which we adults need to understand, as well as children also need to understand. But more important is for adults to understand that children has limitation, therefore we can manage their risks. What are those limitations? There are many limitations, but I'm just going to share or pick up with you only 6 limitations. The first, in terms of vision. They can see, there's no issue. The degree is within only 1/3 of an adult. So say if I'm standing on a roadside as an adult, I have about 180 degrees vision area. But for a child, it's only within 60 degrees. So therefore, if a car comes on the right-hand side, which falls in the 80 degrees area, the child may not be able to see. So we can't blame the child why you didn't see, because that doesn't fall within his range. But only when the vehicle comes within the 60 degrees, the child is able to be too close. Difficult. So therefore, a child, you can't leave them alone on the road because they don't have that capacity to make a safe decision. That's one. Second, if you see, in terms of hearing, they can hear. But their challenge is, from which direction does the sound comes? So if I put a child on a street, on a T-junction somewhere, he can hear approaching vehicle either from the right-hand side or from the left-hand side. Only when the source of the sound gets closer to the child, he has the capacity to know, oh, this vehicle is coming from left-hand side. But again, that may be too late because it's already too close. So these are the second limitation a child has. When I mentioned to you all this limitation, these are mainly for child below age 8. This is where the limitations are. The third group, if you see, if you put a child next to the roadside, he can see to decide whether the vehicle in front of him is a moving vehicle or a static vehicle. When the road surface are so smooth, even we adults having difficulties to know, is that a moving or a static vehicle? Because you can't see the motion of movement. So in that situation, if the kid decides it's a non-moving vehicle, then the kid makes a decision to cross the road. But that judgment was wrong, and when the vehicle is actually a moving vehicle. So that's when we can't avoid a crash. The next, if you see, if they can see the vehicle, it means the vehicle also can see them. But in reality, that may not be so, because we can see a vehicle because the vehicle size is big. But for a driver, say for a driver of a trailer or a bus, he has many things to be seen from his screen. He has to see the vehicle in front of him. He has to see his vehicle system. He has to see the signboards, the traffic light. And among the list of all the items that he has to see from his screen, small part is seeing the kid. So therefore, the kid is not able. So for the kid to judge that, since I have seen that lorry, therefore the lorry driver has seen me. So if the lorry driver has seen me, then the lorry driver will never crash me. That understanding has to be changed. The fifth one is, in terms of, again, their understanding, thinking that if I see a vehicle coming and I decide I want to stop, I can stop immediately. But that is not the real for a vehicle. The moment the vehicle sees you, the vehicle cannot stop immediately. The moment the vehicle presses its brake, it needs some space. So that space and time, if it's not in your favor, then you can't avoid the crash. Let me give you an easy count here. If you are driving at 50 km/h and you saw a child in front of you and you press your brake, your vehicle will only stop after 26 meters. But if you are driving much more faster, at a much more higher speed, at say 80 km per hour, in that emergency situation when you press your brake, you need 58 meters to get your vehicle stopped. So 58 meters is quite a big distance. If there is any kids within that range, then we can't avoid the crash. Kids never estimate or never expect a vehicle can harm them. A vehicle is a dangerous product. Because if it was really a dangerous product, my parents wouldn't have kept the car in the house. I wouldn't be traveling in a dangerous product. So therefore, a product which we keep in the house, a product which we allow the kids to use to travel every day, who has been helping the kids every day, how can it suddenly become harmful for the kid? That's quite difficult for a kid to accept it. Add more, when the kids are very young, we even provide in a form of toys, vehicles in a form of toys, the plastic lorries, plastic buses, everything. So we tend to make them feel very friendly with transport items, with vehicle items. And to tell them, hey, these vehicles can also harm you at a very young age, it's quite difficult to make them understand. So based on this 6 limitation, age 8, you cannot leave them alone on the road. You have to accompany them. An adult need to accompany kids on the road. Okay? Because the kids don't have the capacity to make a safe decision at that particular age. Coming back to the question of public health, since the topic today is, I'm touching on the vaccines. Understanding public health. It's very clear. It's a science to protect and improve health of people and communities. I'm just trying to use the terms here. To protect. So just keep in mind the keywords there. To protect, improve people's health, and then it goes to the community. That means it is individual reaching community. It prevents disease, okay? Again, it's an organized effort, okay? Public health is an organized effort. And it involves organizations, public, private, communities, individual. So keep that in mind. If you want to address any public health issue, or if you declare this is a public health issue, and if you want to solve the public health issue, then you have to engage with all the partners. Without engaging with all the partners, we will have challenge in addressing this public health issue. Okay? You can start with a small up to a country or up to even to the global side. Okay? And why public health issue has to be handled? Because if we don't or we fail to handle public health issues, then you have spillover effects. It will create health disparities. So, if you want to address SDG 1 to end poverty, keep in mind public health issue has to be end, because if not, a poor family who was involved in a crash will become even poorer. So if your goal is to end poverty, then one mechanism is also to make sure you address public health issues. Okay? And the last, which I would like to just share with you, is we have public health professionals. But public health issue, we cannot only burden the public health professionals. Okay? They also have limitation. We need more people to lend hand to help them as well. So, two groups here. One is public health professionals, and the other, my call to you, my request to you. Can all of us become professionals in public health? Therefore, we also shoulder the burden, and then we address it together, and then we lend help to them. That way, I believe we can together address not only these traffic issues as one of the public health problem, but in fact any other public health issues as well. The concept of vaccines. People did ask me, why did you put in the title vaccines? Okay. Vaccines, general understanding people have, is to protect yourself and others. Is to protect yourself, that's the main prime. But so keep that in mind so that later when we map it with the field of road crash, then we can say it. Okay? It's considered, say, one of the safest medical products. Okay, it prevents disease and helps people at all ages. General understanding, if we take vaccine, is to prevent us from getting certain diseases. So the similar concept, and mostly vaccines are being administered by clinical groups. So I'm just introducing public health vaccines. Public health vaccines with a similar aim, similar goal. You want to prevent something. So if I take this public health vaccine with the hope I can prevent crash and injuries. So to address public health issue, I believe we require public health solution. Having said that, I'm proposing some vaccines to prevent road crash and some vaccines to prevent road injuries. These are vaccines which you are familiar with. It is not something that you're not familiar with. But it's just that, do we put in practice all those vaccines? That's the only question. We have to put in practice these vaccines until it becomes our culture. And once it becomes your culture, then it becomes sustainable. The first vaccine in terms of preventing crash. Since the topic is on children, the issue that we have some children, underage children, using vehicles when they are not supposed to. That means they are driving or riding any vehicle without a license because they have not reached that age. If you see the licensing process, the training process as a license, where when you go through the training, you know how to manage your vehicle well, you know how to manage your environment well, okay, then you are safe. That means you are able to protect yourself and at the same time, you're also able to protect others. Keep in mind with the concept of vaccine, which I shared to you previously. It's two goals. One is to protect you, at the same time to protect others as well. So everyone who goes to the road system, keep in mind the vehicle that you are going to manage carries energy, and that energy can harm anyone and can in fact be a weapon to kill others. Therefore, every one of us have a responsibility to manage that vehicle properly. So, never ever allow any kids underage who have not gone through the training, the proper training, and who doesn't has that maturity yet to manage a risk situation, giving him a license to kill himself and harm others as well. So that's my first vaccine I'm trying to share here. The second vaccine, to prevent crash. This is specifically for those who are outside the vehicle, which are motorcyclists, bicyclists, or pedestrian. When you're outside vehicle, you need to be visible. So if you're on a motorcycle, as a passenger, if you are visible, then when I know you are in front of me, I will reduce my speed and I'm able to prevent a crash from happening. But if you are not visible and my vehicle gets closer to you, and when my vehicle's source of light hits you, then only I know I have someone in front of me. So that might be too late because a crash will happen at that time. Okay? So for those who have children traveling on a motorcycle as a passenger, please make them visible. The best is to use a reflective vest, but in the least, if you don't have one, at least for a minimum, use bright clothing during night time. Okay? The next vaccine is bicycle lane. Why do we need bicycle lane? Any groups which are vulnerable, any group which has a low speed, compare the same road with and who are vulnerable, we have to protect them. And one way to protect them is to segregate them. You segregate them and put them within their group of people, then they will be safe. So on that ground, there are 3 groups which requires segregation. One is pedestrian, the person with the lowest speed, then bicycle lane, and then motorcycle lane. These are 3 groups. Motorcycle, of course, the speed is high, but we need to segregate them because they are vulnerable. The moment they mix with the other vehicles, in a crash, when it happens, no matter who is at fault, but the group which is going to receive the impact highest is the motorcyclist. It is. I hope if there are anyone here from the local government authorities, during the land use planning, if you can accommodate that keep in mind the road belongs to everyone, not only vehicles. The road belongs to all type of road users. So change the form from vehicles to road users. So when you know your road is going to be used by pedestrian, by cyclist, by motorcyclist, then you cater for that. When you know pedestrian facilities, which I want to touch a bit more, since it involves children. Children are captured audience outside school areas, a place where they commute 5 days in a week, in a large number. So the school area has to be really safe for children. There are few ways to make the roads in that school zone safe. One is in terms of providing pedestrian facilities. There are many pedestrian facilities, but try to provide pedestrian facilities where it is more comfortable to the pedestrian rather than vehicle. That means instead of building overhead passes, which makes it easier for vehicles to pass through without, because they have to climb up the staircase and then get down. It's a bit more long journey, that's one. And keep in mind, if the kids are carrying the school bag with the load between 8 kilo or 10 kilo, expecting the kids to climb up the staircase and get down the other side may not be attractive for those kids. Okay? So the best is if we can provide at-grade crossing that will attract kids to cross, but at the same time, we as road users, or we who are using the vehicles, we need to split the pedestrian crossings in the school areas because our kids are crossing, and the kids can cross any time they want. So if we can provide such an environment where we make the environment safe for the kids, then it will attract the kids to use the facilities which is being provided to them. Then I think collectively we can see some differences outside the school zone. Speed reduction. There are many slides in today's presentation. But if you force me to say that you can only remember one slide, which is the most important, then I would say the most promising intervention is speed reduction. One vaccine, second, in the event if this crash is unavoidable, it can also prevent injuries and deaths. So if we don't invest in speed reduction, then we lose a lot, because the ROI, the return on investment on this vaccine is huge. Okay. So next is say we cannot avoid a crash. Now a crash happens. So what can we do now in the second phase is to prevent injuries and fatalities. And again, I'm touching on the speed reduction. for your understanding, all our human body, we can tolerate to a certain extent our injuries. All our body, say I'm standing outside the road, a vehicle comes and crash me. If the vehicle crash me at say 20 km per hour, my body is able to absorb that energy and tolerate that energy, and most likely it will never lead to fatal. But if the vehicle which comes and crash me at 60 km or 70 km per hour, that transfer of energy is beyond my tolerance level, and that is a time when it can lead to fatal. So that is one reason why in school zones it's always recommended for 30 km per hour school zones. You might find it's very low, 30, but that's the limit that we human can tolerate. We can't tolerate beyond that amount. The next is motorcycle child safety helmet. For a motorcyclist, whether it's a child or an adult, we don't have much product to save a motorcyclist or a bicyclist in an event a crash happens. The most promising product we have is the motorcycle helmet. And for child, we have a specific child safety helmet. You can see those child helmets later outside in the exhibition. The difference between adult helmet and a child helmet, and among the child helmets, which is the one standard, which is the one non-standard. Okay, we have a video clip as well, but at the same time you get a chance to see it face to face thanks to the Road Transport Department's exhibition booth outside. Next is bicycle helmet. It is not a law in this country to have a bicycle helmet, but does that mean we shouldn't wear one? If we are only going to wear a bicycle helmet the moment there is a law, that means the whole purpose why we are using the product is mainly to fulfill the legislation needs, and not because we believe that product can give us protection. If we believe that product can give us protection, why are we waiting for the law? Or why are we waiting for the enforcement activity? If we believe, if I provide a bicycle helmet to my child, therefore that product can save my child in an event a crash happens, it can prevent head and brain injuries, start giving one. So that culture has to change from needs, changing it to because of safety needs. Once there is no enforcement, we will still be complying because we are worried of the risk behind it. Next is airbags as a vaccine. Of course, we can't do much here because airbags is considered as a passive safety measure, whereas the helmets are all active safety measure. Active safety measure here means you decide you want to use or not. But airbags are passive. The moment the manufacturer builds it, then the consumer doesn't have a choice. The consumer only has a choice when he wants at the purchasing point, when he decides the type of vehicle he's going to buy. That is a point where he decides. So my call over here, there might be many reasons for you for consideration when you want to purchase a vehicle, and many other reasons. Can you put in safety into that consideration, and you raise that safety consideration to the highest point within your list of consideration? And to help that, if you see, in the country, the Malaysian Institute of Road Safety Research, which has done a lot of crash tests, they have the star ratings for the vehicles, which they have tested. And they have published it. It's a public domain. Correct, Prof? Yeah. So, consumers, you don't have to go anywhere. Visit Mirror's website for you to see the type of vehicle which they have tested and which they have given the star rating. The highest star rating is 5-star rating. And I would prefer that as a consumer, use your power as a consumer to change the field. Consumers, you can drive the field seriously. If you start demanding that you only want 5-star rating vehicle, automatically supply will come in, because supply will be nothing. Consumers, your power, if you use it well, you can change the industry in the whole country. Next is seatbelts, the next vaccine. It is not something new. You are very familiar with the seatbelts. Front sitting as a driver or a front passenger makes a quick change when he goes to the rear sitting. He doesn't wear one when he goes to the rear sitting. Does it mean in the rear sitting you won't be involved in a crash? Or does it mean even if you're involved in a crash in the rear sitting, nothing will happen to you, no injuries will happen to you? Is there any kind of immunity in the rear seats that prevents you from wearing one? The risk is there. The risk is there. Can we start making it a new practice, a new norm? Start with us and then bringing it to our family members and bringing it to our close friends. That no matter which seat we sit in the car, as long as there is a seat belt being provided, it must be a must for us to use a seat belt in the car. And to all drivers, or whoever who's sitting in the driver position, my kind request, don't start your journey until all your passengers who are seated behind have already fastened their seatbelt. There is a reason behind it. Why? Let me tell you. If if the person sitting behind me is unbelted, it means he is unrestrained. In a crash, what happens? He will be moving and he will come and hit me. So even though I'm belted, I'm restrained, but because now there is a force from behind hitting me, it will injure himself and it will also injure me. And the force is based on the weight of the person sitting behind you times with the speed where we are going. If just imagine if it's about 70 kilo, you're driving about 70 kilometer per hour. The force is 4,900 force on you. So that's the reason I'm asking. All those drivers and front passenger, don't think you are safe just because your passengers are not. Let's change it. Together we can make this change. And there is also a proper wearing of seat belts. The seat belts has to touch your body at every point of time. There cannot be a space within you and your between you and the seat belt. And the place where the seat belt touches your body is at your shoulder. And for the 3-point seat belts, so this shoulder belt, the purpose of the shoulder belt is to restrict your movement from going in the front because it pulls you back. And the lap belt which you are going to wear, which should cross your hips, is to reduce your movement from going up. So the lap belt is going to press. So these two things will go in tally. So that's why we need everyone to use the seat belt properly. The next is child restraint seat, which is much more closer to my heart. Okay? Both are restraint systems, seat belt and child restraint seats. It's just that when you're not fit to use a seat belt because of the height, we need to move until you have reached the required height, then we can shift you back to the seat belt. How do I know? Say, for example, I have a child. How do I know whether my child requires a child seat or he's okay to go to seat belt? So take your child, put him in the rear seat, Start fastening the seat belt and see whether does it touch the shoulder or not. If it touches the face and the neck, that means his height is short. He's not fit for seat belt. We need a child restraint seat. That's one checklist. Second, when he's seated, you can just see whether he bend his knee or not. And the third, whether his foot is touching the ground or not. Is short to meet. That means the kid needs a child restraint seat. So that's how we decide whether you're going to child restraint seat or you are already ready to use a seatbelt. So, since child restraint seat was a new law being passed in the country, it was gazetted in December 2019, but many of us forgot about hitters. So when COVID hit us, COVID was there in front of us and all other things have just gone behind us. Okay, so this is one forum for me to raise the agenda back, okay, for me to highlight about this child restraint seat that we should know. Child restraint seat here means the first message is every car passenger need to be restrained. It doesn't mean, say for example, I have a child and then next to him is an adult passenger sitting and I think the child is safe. The child is safe because the child is in the child seat. But if the person sitting next to the child, an adult, is unrestrained, the child is still not safe because the unrestrained adult is going to be moving around and in a crash is going to hit the child. So it has to be worked hand in hand. You cannot only work on child restraint seat, you also have to work with seatbelt. That means the bigger topic is vehicle restraint system. Every passenger in the vehicle need to be restrained. If you're an adult, the product is seatbelt. If you're a child, the product is a child seat. Then only the child can get a full benefit of that product. So the challenge we have times, that has to change. This is what I explained to you, the difference when do we decide seatbelt and when do we decide child seat. And the third one, the law requirement. The law requirement is very clear within the country. Ministry of Transport has taken the lead. Okay, the law was passed, age below 12 or height below 135 centimeter or weight below 36 kilogram. But among all these three indicators, the indicator on the height is the most crucial one. Okay, because that decides whether the shoulder pad is going to touch your shoulder or not. How do I know? Say now you have decided you want to get a child seat. But as a consumer, we need to empower you as a consumer that the moment you have reached a point where you are willing to get a child seat, we need to make sure you get a proper one. You need to get a standard child seat. What is the difference between a standard and a non-standard? A standard child seat means it has gas, therefore it can provide protection to the child. I'm sure that's the whole reason why you want to get a child seat. You want to get a product which can give you the protection. And to know whether the product can give you the protection or not is the standard. So to help consumers know when they go to the shops, is this product is standard or non-standard? Malaysia follows the UK ones. So look for the label UNR44 or R129. It is orange in color. Of course, previously, before the law came into place, you may have your own child seats from different countries. The law is quite flexible, more soft landing. You can still use. They're not saying no. Okay? But for all those after the law being gazetted, you will be following these new ones. Okay? And then selection of child seats. When you decide that you're going to get a child seat and you know now you're going to get a standard one, you know how to decide which is standard or non-standard. When you want to do it, every child seat is based on the kid's height, age and weight. So I would always recommend bring your child to the shop, let the shop take the weight of the kid and the height of the kid, and then only start looking at the products which match that height and the kid. So for child safety seats, please bring your child together to the shop. That would be really helpful. Okay? There are many types of child seats based on the group. That what Malaysia follows is group 0 until group 3. Okay? It goes from infant, from newborn baby until until you reach the booster seat. And also, we also have special child seats, which not many are aware of. It is from the medical reports, you can request. Okay, there are some manufacturers who are catering for this kind of needs. So for any special kids, there are also child seats which are possible. Because the idea here is every child who are traveling has to be protected. We shouldn't lose any child from a preventable crash. As every product has an expiry date, a child seat or not, where it's being produced. If those produced in US, the expiry date is mentioned. It's at the bottom of the child seat. It's mentioned the date of expiry. But if it's produced in other countries, they don't mention it. Not mentioning doesn't mean no expiry, because due to wear and tear, it has expiry as well. So, a rough indicator between 5 to 7 years. If you don't have an expiry date, just keep in mind about 5 to 7 years. But if that product was involved in a crash, you may want to replace it immediately. You may not see it from outside, any damages, but you're not sure what is the damage inside. Okay? So keep in mind of that. When you're buying a child seat, we always request, if it's not a requirement, we request with the manufacturer. Because in case if there is a recall, then at least the manufacturer can reach out to you because they know who are the consumers. Okay? So even if there is no requirement, our recommendation is do register with the manufacturers. And after getting a child seat, after getting a standard child seat, it is not enough. The biggest failure happens is in terms of installation. If you wrongly install, you're not going to get the proper installation is so important in a child seat. And to install it properly, you have to read 2 manuals hand in hand. The first manual is the car manual. When you buy a car, the car will have its manual. I'm not sure how many of you all have read your own car manual. Manual will tell you in that car in which location you can fix the child seat. That's why the car manual is so important. That car manual will tell you, say whichever you buy a car A, that in that car A it will tell you can only fix in 3 positions or you can only fix in 2 positions. So that's why the car manual is so important. And the second manual that you need to read is the child seat manual. That means the child seat manual will tell you how to fix the new child seat that you bought in a place where it has been identified by the car manual. So that's why 2 manuals has to go hand in hand. In the beginning when you're buying, maybe the shop people will guide you, will teach you. Okay? But subsequently, don't forget, you are going to use it every day. Sometimes you will have it in car A, and then tomorrow when you're traveling for some other reason, you might shift that child seat into a car B. So you need to know how to install, uninstall. Install, uninstall. You have to be very familiar with it. You start doing it. becomes norm. Please, only a properly installed child seat can give you the protection. If not, how good the product is, how many thousands you buy the child seat, if you don't install it properly, you won't be able to see the benefit behind it. And 11, the location, installation location. In a car, you have the 3-point belt system, 2-point belt system. What I mean here by 3-point belt system is only the lap belt. Okay, most of the car seats will only go into the 3-point belt system. Okay, children sitting. Generally, rear sitting is much more safer. Not only for children, even for adults. Okay, so back home, try to fill up the rear seats first before filling up the front seats. Unless those who got no choice, who have to drive, only let them drive. Okay, but your first choice always sit in the behind. Of course, we know kids prefer to sit in the front seat because they get a better view. They don't have to share with their siblings. The front seat is like a business class sitting. The rear sitting is like comes with more risk. Okay, so I would recommend start filling up the behind seats first. And for a child seat, the safest zone is always rear sitting. Okay, and you can check your manuals as well. Some manuals don't even allow the front seat to be used. But for those manuals which allow front seat to be used, keep it as provided the manual allows. Even after the manual allow, the front seat is the last choice that you want to use for your child seat. Okay, which is the first choice? The first choice is always behind the front passenger. Okay, so say I'm the driver, I have front passenger, behind the front passenger, it's the first choice. Can you see even in any VIP cars, the driver will be sitting here, the VIP will be sitting on that point. First choice. Second, the third choice is very subjective, depend on the what does the manual says. Okay, if the rear sitting middle can be used, if it has a 3-point belt system, yes. Okay, but again, the last choice is always frontal passenger. In a diagram, this is what being held by Miros. They have developed this guideline, and they have shown you in terms of the recommendation by numbers. First choice where, second choice where, third and fourth. Again, these are their recommendation list, but please do cross-check with your. Okay, this is a generic recommendation. Can you see position number 1 and number 2 never change? Your car can change, no matter how many passengers your car change. Position number 1 and 2 remains, and the last position will also remain. Always the front passenger is the last position. Okay? The middle one can always change. If your car is much more bigger, again you can see 1 and 2 and the 7 will remain. Okay? If you need to do any changes back home later, please feel free to do changes. Okay? Right, children facing. Facing front as the vehicle moves, or facing rear, opposite to the vehicle movement. Okay? For those, the safest is facing rear, not facing front. In fact, the manual itself would have said to you, facing rear. As much as you can keep the kids rear facing, that much the kids are safer. Okay? And then only finally you move them to the front facing. So always keep in mind, as the more longer you can prolong the kids for rear facing, okay? And the front seat, as I told you, last choice, preferably we don't want. Okay? But the worst scenario, we need to use the front seat also. Then, in terms of the choice, give it to the most eldest child, or give it to the child who needs the most protection. Give it to the first position, which is behind the front passenger. The one who needs the least protection among the kids who are traveling, that kid goes to the front seat. And then it has to be front facing, can never be rear facing. The reason is because you have an airbag there. Okay? And then when you are putting it front facing, I would still end up more by asking you to move the seat behind as between your car seat and the airbag source is at the maximum distance that's possible, because your risk is from that airbag. Okay? So those are the 15 points that I wanted to really share on this child restraint seat, so that we can start providing a safe protection, a safe travel for our kids. And for those who are more interested for the details, that that guideline is there in Mirror's website. Okay, you can have a look. So the way forward, if you say. Quick one, way forward. As I told you, which roads we are using, doesn't matter whichever roadway, reduce the speed. That will make us safe and make others also safe. And particularly in school zone, please, let's keep it to 30 km per hour. If there's any local authorities or if there's anyone from Public Works Department who owns the road, because the owner of the road only can designate the speed of that area. So the owners can be Public Works Department, or the owners can be local government authorities. Okay? So these are the people whom we hope we can convince, okay, in order to make sure that the speed being introduced, there is an advisory speed limit, okay, hopefully it can be guessed. The third one is optimizing enforcement. We need enforcement because education takes time to change people's behavior, but it's sustainable. Enforcement can change your behavior immediately, but not sustainable. You just look at a road, wearing a seatbelt, you will wear a seatbelt. I can change your behavior immediately by introducing enforcement. But the moment you pass by the roadblock, there is a possibility you may go back to the old behavior. So, but if we combine both, enforcement to get that first quick return and plugging in with the education to make it. And next, besides that, enforcement, why are we burdening the enforcement authority only on enforcement? Aren't there any other type of enforcement? Where is self-enforcement? Isn't it that we benefit the most if we wear a safety helmet? Why is it that we want others to tell us? So if that self-enforcement comes in, it will reduce the burden from the enforcement agency. And where is the community enforcement? Where is the employee enforcement? Because sometimes we are violating any rules compared to the state rules. So if industries start playing their role, together we can make a huge difference in terms of enforcement. So therefore, only the last stage only we need to depend on the state's enforcement. Exploring new partners, this is what I see for the field of road safety to be improved in the country. We need to engage with these industries and employers, because as an employee, we know our employer, the employer knows us, and the moment we violate any rule, the employer knows us, therefore we try to comply with the rules. Can raise, I believe we can make a huge difference here, because it's a win-win situation. If you are not involved, if you are involved in a crash, then there is an absenteeism at the job place. So when there is an absenteeism at the job place, it also affects their production. So when you are not, and also affects their compensation later on. But if you are not involved, you are free from crash and injuries. The company's job continues as usual, no disruption, no compensation. So win-win situation. So a call here to employers. can you raise the agenda of safety, protect your workers, to show your caringness to your workers, protect them, and as well, you contribute to the nation as well. And unions, they will champion the welfare of their workers. Isn't it safety is also part of the welfare? So if unions can champion welfare in a larger context, the safety of their workers, then that's another voice, a much more louder voice. Okay, much more louder voice on road safety to be heard. That's one. Retired workers, retired groups who have associations. In some of the abroad countries, the retired workers, they are retired, they are not tired. They just retired. Their time, and if we can tap their experience, we can make a difference. In one of the countries, they were using the grandmother as an advocate for child restraint seats, because the resistance could come from that age group, because they were the one who never used child restraint seats last time when they were raising their child. But then when you advocate them, when you change them to be on your side, that helped out. So that's one group to look. And the legislators and the royalty, which we never used much. Okay? In some countries, they even use those retired legislators, those former legislators, okay, who knows how the policy really works. Okay? And some countries also have royalties coming into picture to be a champion, to give a voice to that issue. Hopefully, for road safety, we have someone coming up along that line. Where is the game changer? I believe the game changer is surveillance. To say that you are being watched, you are being seen, that means the probability for you to be seen, to be stopped, to be caught, to be fined is much higher the moment you violate any rules. That will make a change. We are more worried of the camera enforcement, because we know the moment camera enforcement is there, we reduce our speed. Suddenly, we will change from unsafe behavior to safe behavior. Okay, but we don't have the resources to put camera everywhere. But changing the game changes if every consumer, every individual is having a dash cam. It also helps others. Keep in mind the concept of vaccine just now. It protects you, it protects others. So if you have a dash cam, people know that they are being watched. So it doesn't only helps for road crash issues, it goes beyond the field. It also helps in terms of crime prevention. It also helps in terms of vandalism. It cuts across. So dashcam can make a change. If everyone believes dashcam can make a change, then hopefully more players comes into picture, more insurance industries comes into it to make it much more lower price, because everyone benefits from this exercise. Start place when you have some of your friends who has a newborn baby. We tend to buy hampers or whatever it is. Can we start a new norm by gifting a child seat to them, by pulling resources and gifting them a child seat? Then if we can start changing that means we start gifting safety products along the way. I think that will make them much more safer. If you are talking about child safety, and we know the captured audience of these childs are in school, and if we don't engage them fully, or we don't optimize that gap, cooperatives, shop outlets, which sells the school books, and some schools even sells school uniforms, school shoes, and everything they sell. But they don't sell safety products. Sometimes parents, they know that the kids needs a helmet, a motorcycle helmet. The parents wants to get a standard motorcycle helmet, but the parents doesn't know where to get, because not many shops has that. So, but if every school outlets can make it available, that would be very helpful as well. The next one, I have total 10 here, the 8th one. Everyone are talking about political will. We need political will. Yes, we need political will. But bear in mind, not all decisions are done at that topmost position. There are quite a number of decisions which can and has been done by the... So we are losing the middle managers stage. We are talking about top down or bottom up. But where is the middle down or bottom middle? If that pathway is not being fully optimized, there are quite a number of decisions which can be done in that small pathway, which we can. So let's optimize that part as well. As well as who also advise the top people on their recommendations of what to be done. So let's capture these middle managers. The role of media. We hope we have media friends here today who has been very helpful to UPM. I'm sure Prof. Ismi would agree. Media has been very helpful to UPM. Let's see them more as media partners rather than just for coverage. The last 2 years, what we do is we run empowerment programs for media personnel because we want to make sure that they are safe and their families are safe. And when they go through the empowerment program, when they write the reports later, it's more lively. There is a life behind each write-up rather than a normal coverage. So on that ground, we hope we can continue with that continuous empowerment sessions for the media partners. Okay, because we really need media. Because say if in this room we have say 300 people, that means this message is reaching 300 people. But our media friends, they can amplify it, the size of this room. So you need both to have a direct reach out within this room and then to also have the amplifying factor. And the last one, I've never came across any registered organization on road crash victims. Despite we have 6,000 deaths every year and many more thousands who are being injured, who are disabled, but we don't have a crash victim association. If we need one to raise their voice, because these are the people who were involved in a crash, full compared to I'm speaking over here, because that is a real incident. I'm talking to you about probability of an event happening. They are going to tell you what has happened. So this is a group which I feel we have not engaged much. Conclusion. If you believe the public health for vaccines, if you believe in those public health vaccines which I shared, which is to prevent crash and to prevent injuries, then let's put in practice. Please put in practice first. And when you see the benefits, and then you start preaching to others. Preach to your most closest family members whom you can observe their practice, and after that only start moving to the larger community in the group that you can observe closely first. And repeating that practice will lead to culture. Say if I start wearing a seatbelt every day, after some time, if I don't wear a seatbelt, I'll feel so uncomfortable. I'll feel so odd. It's something like when you wear a watch every day, and suddenly one day when you don't wear a watch, you feel something is missing from your hand. We have to practice for that practice to become culture. Once it becomes culture, then you can disengage. After that, you don't have to tell him anymore to wear his watch, he will wear. Or another easy example, when the kids, you have to maybe remind them the early age, do brush your teeth, do brush your teeth. After that, it has become a practice because they are continuously doing that practice. It has become a culture. You don't have to tell them anymore. So that's what I'm saying. Continuously doing a safe practice will lead to culture, and that culture will become sustainable. And once it becomes sustainable, then you can disengage. And keeping in mind that Malaysia has a safe culture, whether you realize or not. This is what the founder, Director General of Road Safety Department used to say, that if you realize that we start our day with Selamat pagi. Selamat pagi. Selamat tengah hari. Selamat petang. Selamat malam. People come, you say selamat datang. People go, you say selamat pulang. In every activity in a day, you incorporate selamat. Can we go beyond and from our lips into practice? With that, thank you very much.
Okay, thank you very much, Prof. Kulan. Very insightful lecture. Of course, the gist that I can take up basically at the end of the day, with all these vaccines, I think it goes back to road safety education. I think if we can, I know that means of road, basically emphasizing, on raising the awareness. Inshallah, I think with that, with complementing all these vaccines, we hope to have a safer, road and journey, in our day-to-day life. The thing that I like about Prof. Kulan's lecture is that I saw Prof. Izani of University Malaysia. Last week I went to Terengganu. I visited the family of our late student who passed away, involved in a road accident at the traffic light. And of course it is about when we basically, of course, it is still under investigation. But of course, one of the causes was it happened during the yellow light. So the thing about Malaysian, we don't know whether the yellow light means us to be careful and stop our car, or the yellow light means we have to press further so that we can. So I think that is something that we need to ponder. I think road safety education. And we learn a lot, from your lecture today. Alhamdulillah. Jadi terima kasih diucapkan kepada yang bahagia kena bersekutu Pertahanan Awam, Profesor Dr. Kulanthayan Kesimani, atas syarahan inaugural sebentar tadi. Saya amat tertarik dengan perkongsian mengenai komitmen beliau terhadap keselamatan dan kesihatan kanak-kanak dan ilmu dari Jabatan ke arah kesejahteraan masyarakat sejagat. Beliau memberikan penekanan pada penggunaan terma road crash dan bukannya road accident. Saya ingat sewaktu di AKAP, bila kita di Akademi Kepimpinan Pendidikan Tinggi, untuk melahirkan lebih ramai pensyarah-pensyarah yang boleh mengajar dengan inovatif dan efektif. Salah satunya adalah of course problem based learning, di mana kami banyak menggunakan rancangan di National Geographic, the Air Crash Investigation, sebagai bahan pengajaran untuk develop this critical and creative thinking among our lecturers and students. So maybe Prof. Kulan boleh cadang kot road crash investigation as part of educating our society. Bila kita tengok siri tu, kita dapat belajar how to prevent ourselves and not to basically just find who's at fault. Maybe itu cadangan kerdil saya lah. Okay. Dan pada kebiasaannya kita selalu mendengar terma vaksin digunakan dalam bidang klinikal perubatan. Selepas pandemik COVID, dunia melihat tinggi akan keperluan dan kepentingan kesihatan awam. Dan di sini syarahan Prof. Kulan memperkenalkan konsep baharu penggunaan vaksin dalam bidang kesihatan awam dengan matlamat dan niat yang sama, iaitu melihat kepada alat perlindungan mencegah sebagai satu lagi elemen yang penting bagi memastikan kita dapat insya-Allah mengurangkan kemalangan dan kecederaan di jalan raya. Jika public health vaccine yang beliau kongsikan dapat diamalkan oleh semua pengguna jalan raya, insya-Allah saya percaya kita boleh pastikan jalan raya kita semakin selamat kepada semua pengguna jalan raya, termasuk anak-anak kesayangan kita. Saya dengan ini nak menjemput Prof Pulen untuk ke hadapan sedikit berdiri. Sila Prof. Sila pusing menghadap audience. Boleh kita bagi tepukan yang paling gemuruh kepada Prof Pulen. Thank you very much Prof. Akhir kata, saya percaya hasil kajian yang dilaksanakan oleh Yang Bahagia Kenal Bersekutu Pertahanan Awam Profesor Dr. Kulanthayan Kesimani telah memberikan impak yang besar bukan sahaja kepada universiti, malahan kepada masyarakat, negara dan global. Mendalami ilmu dalam bidang yang diceburi dan seterusnya menjadi insan yang bermanfaat seiring dengan moto UPM berilmu berbakti. Sebelum saya serahkan majlis ini kepada pengacara majlis, tahniah sekali lagi saya ucapkan kepada Yang Bahagia Kenal Bersekutu Pertahanan Awam Profesor Dr. Kulanthayan Kesimani. Marilah sama-sama kita doakan supaya beliau dipanjangkan umur, diberkati. Sekian, wabillahi taufiq wal hidayah. Wassalamualaikum warahmatullahi wabarakatuh. Terima kasih.
Majlis merakamkan ucapan jutaan terima kasih kepada Yang Berbahagia Profesor Dr. Ismi Arif bin Ismail. Sebelum majlis melabuhkan tirai, marilah kita bersama-sama menyaksikan persembahan